Thank you.
Great. All right, well, welcome everyone, and thank you for choosing our session, The Ready School. I'm going to introduce my wonderful and amazing coworkers. We have Tamara Lemley, who is our curriculum director, and we have Nicole Hancock, our health and nutrition coordinator, and Janine Williams is our federal programs coordinator. And my name's Nicole Shetterly. I'm the family engagement coordinator, and we all work for our preschool program here at Toledo Public Schools. So the next slide, please. And we are going to go over our objectives. I just want to let you guys know that our objectives are participants will understand that health disparities exist in African American populations. Participants will understand that health disparities can lead to adverse classroom outcomes. And participants will understand ways to support their families in addressing health disparities.
Okay, I am going to give a brief overview of the School Readiness and Success for Young African American Boys initiative that our program is a part of. This is a Head Start Region 5 initiative, and Region 5 consists of 6 states, which is Ohio, Michigan, Minnesota, Wisconsin, Indiana, and Illinois. And the purpose of this initiative is to develop tangible resources and training modules for educators and others working with young children to improve their interactions, teaching strategies, and collaborative efforts with parents and communities to enhance school readiness outcomes for young African American boys. So TPS Early Childhood started with this initiative in 2015. We were a part of the first cohort. At that time, we focused on pilot sites and we provided training and professional development for our staff. In 2016, we created our school readiness plan for young African American boys. We used data from surveys from our staff and families. And we also continue to participate in webinars and face-to-face professional developments that was offered through Region 5. In 2017, we really started to dig into the data from our teaching strategies goals assessment, and we started to compare the student outcomes from young African American boys and their counterparts. We also established our fatherhood initiative, where we encourage fathers to be a part of their child's educational journey. We provide programs and events pre-COVID to get those fathers in the door so they can learn about what's going on with their child's learning and development. And then in 2018, we made changes to our original plan and we targeted a focus and really streamlined our goals. And then in 2019 and beyond, we decided that we really wanted to share this, get this information out. We didn't want to keep it just in our early childhood program. So we started to share our plan with our district and with our equity, diversity, and inclusion department. We want to push this information up so it follows our children to graduation and beyond. We also decided to share our information with our delegate agencies. Our Head Start grant is Birth to 5. We have 2 delegate agencies, and we really wanted to make sure that they were a part of the conversation as well. And then right now, what we are doing, we're trying to do, since we're kind of navigating through COVID, is really get this plan implemented, take it from being on paper and putting action to it. We can go to the next slide. So why, what, and how? So some may question, why is the focus on African American boys and not all boys? And we do understand that sometimes classrooms are not set up for success for boys in general. However, the outcomes for Black boys are more challenging. Black boys, their learning styles and communication styles, social skills are sometimes viewed as problems for educators, which leads to suspension, expulsions. I'm sure you've heard of the pipeline to prison. So we want to reduce that. And we found that African American children are expelled from preschool at twice the rate of whites. Boys make up 91% of those expelled. So what is our school readiness plan? We have a focus on social and emotional development, creating a nurturing educational environment that supports the social and emotional development of young African American boys, creating positive parent-child relationships by supporting families through the Family Support Partners, completing the family outcomes assessment, and creating family goals. So we have 4 main goals within the plan. One is for family engagement. The other is for fatherhood engagement, health and nutrition, and we'll talk about health today. And the last one is for our education goal. Staff will provide a culturally responsive teaching environment that will foster strong supportive relationships with adults and other peers. And I do want to mention with our health goal, it's not just for the children. We do want them to be healthy, but we find if our staff are mentally healthy, if they are physically healthy, that the classroom environment will be more productive for all of our students. And the last question is, how can I get involved? So our goal today is that you'll understand ways to support families and our children in addressing health disparities that exist in our communities. And now I will pass it on to Nicole Hancock.
Hi, good morning. So we're going to focus on the health aspect of the school readiness and success for African American boys. And the reason why health is such a huge part of it is because over the last few years, there's been a lot of discussion about health disparities. There's a lot of health disparities in minorities specifically. We put a couple of facts up here, but all of these are pulled from the American Progress. So we have that link here if you want to spend more time viewing that. But just some data, 12.6% of African American children had asthma compared with 7.7% of non-Hispanic white children. And we'll talk more about how this is going to affect kids in the classroom and what we can do. 42% of African American adults over 20 suffer from hypertension compared with 28.7% of non-Hispanic white adults. 8.7% of African American adults receive mental health services compared to 18.6% of non-Hispanic white adults. So what is that saying? They're saying we know they aren't suffering less, but they're not receiving the mental health services that they need. African Americans have the highest mortality rate for all cancers combined compared with any other racial and ethnic group. And there's a lot of discussion as to why this is happening, what the difference is. In the next slide, one of the things that we've talked about and that is really coming to the forefront is something called minority stress. So everybody has stress, everybody has experienced that and knows what that does to you, at least short term, but minority stress is additional stress in members of marginalized groups because of prejudice and discrimination. It's a constant. So it's chronic, it's unique, it's socially based. It causes cortisol levels to be high all of the time, which leads to very poor health outcomes just in general. And so the biggest part of this, the biggest takeaway is that minorities have health disparities. They do partly because of factors like minority stress. And it's something that we need to acknowledge and understand and realize that they're coming from a place, a harder place than most people. And that we do need to support, that everybody needs to support them. Let's go to the next slide. So Lucas County in particular, in the 1920, Lucas County every 3 years does a community health assessment. And this year they broke out information based on minority factors. So there were a lot. So if you wanted to spend time looking into that, they even have some great YouTube videos where they outline exactly the differences between the minority groups and some of the health outcomes and health disparities. And it also, there wasn't a ton of breakout in minority groups for youth, but they did show that there's increased risk behaviors in Lucas County minority youth. In general, like we said, nationwide and in the state, students in urban schools have less access to healthcare, fewer resources available, poorer health outcomes. It's amplified in minority populations, and there's an additional link for more information. Thanks. In addition, infant mortality is huge, it's especially huge in Lucas County. I think I saw somebody on here who works with infant mortality. So if you're looking at that top boxes, this is nationwide in 2018. So the mortality rate per 1,000 live births in the Black population, it's 10.8. In the white, it's 4.6. I mean, that's a huge, huge difference. So 2.3 ratio. Now you look down in the bottom towards Lucas County, and what do we look like? Our Black infant mortality rate is 15.9. and the black and white ratio is 2.8. So this is a problem. So the point of all of these slides and the discussion is health disparities exist. We need to acknowledge them. We need to keep that in mind when working with minority populations and with minority families and African-American boy families in our programs. So moving to our next objective, or how do we address this? Like, what does health have to do with us in early childhood, and how, where are we coming from when we're like, oh, health is one of our goals when we're doing the initiative for school readiness and success for African-American boys? Well, it's an initiative across all of Ohio. They've got the whole child framework, and the whole child tenet number one is that the child is healthy. If your child is not healthy, they cannot learn. And that is something that I think gets missed a lot in traditional education. Traditional education, it's like, what are we teaching? What is the child learning? But making sure that they're healthy is hasn't been the first goal. And now whole child tenet number one, healthy. OD set clear expectations on that. So that's kind of where our starting point came from. So how does health affect the classroom? And a lot of this is really intuitive. You just don't really stop to think about it in the day-to-day. Like, yes, we know this, but the day-to-day doesn't occur to you. So dental disease, for example, if you have a child, and we've seen children with teeth rotted down to little tiny nubs, they're in constant pain, everything's brown or black in their mouth, they cannot learn. Like, if you're sitting there, if you've ever had a toothache, you know how that feels. There's not going to be any learning. There's not going to be any focusing. There's not going to be any attention. I'm not even going to be able to sit still. Dental disease is huge, and is something that it would be great to look at in the classroom or in an early childhood setting. Lead levels. We in Ohio have some of the highest lead poisoning rates in the country. So I believe the last percentage was about 3 to 5% of our children in Ohio have elevated lead levels. And what is an elevated lead level? It's 5 or above. It's like 5 micrograms per deciliter, but basically it comes back as a number. And if it's 5 or above, it's considered elevated. How does lead levels affect the classroom? If you have elevated lead, it's affecting your development. You could end up with delays, like you're not now growing and thriving, which is why lead is such a big issue in our babies to at least 5-year-olds, because if you have high lead levels, that's when they are developing the most. And if you start arresting that development, you're going to have a lot of problems. Behaviors, delays, even things like speech delays really pop up. One story that I always come back to. So in Ohio, and just Medicaid across the US, they recommend lead testing at 24 months and 12 months and 24 months. So that's twice. And if I'm a provider and I screen a child at 1 year and 2 year, I can check the box and be done. But a child can get lead poisoned at any point in time. I'm definitely an advocate of screening more, but that is the current minimum recommendations. So we had a child who came to us. He hadn't had any lead testing done. We tested him in March. His levels came back normal. Over the course of the summer, mom started noticing concerns and behavior concerns and how he was acting, almost like a regression. She took him to the doctor because she was on it, and that's amazing. The doctor decided to do another lead test, even though he had just had one done in March. And usually you don't test more than once a year, which I thought was amazing as well. And his lead levels came back elevated. And what happened? Well, what happened was mom got the child a sandbox over the summer to play in, something nice sensory activity for the summer, put the sandbox in the garage so that this child wouldn't be sitting in the sun all day playing, and the garage was just filled with lead paint. And so he ended up getting lead poisoning. And she noticed that from the behaviors. Moving on, family health. So if you've got chronic disease, depression in the family, if you've got a parent who is battling cancer or in and out of the hospital for heart failure or whatever, I mean, that affects the family hugely. And it affects the child. So you've got those behaviors going on. It's going to arrest even their development can be arrested from all of that stress at home. The child has chronic diseases. Say you have asthma, anemia, which can be common in young Black boys with sickle cell. These can affect the child in the classroom, affect their learning. If they're always trying to, if they're in and out of the hospital, or they're just not feeling well, and you don't even realize that that's what it is, it's going to affect their learning and their behavior. And then nutrition. So Nicole and I have been working, we feel very, very strongly that nutrition is a huge aspect of our lives, of some of the major concerns that are happening across the country. She's going to talk for just a second about nutrition.
Yes, nutrition plays a huge role in how a child functions in the classroom. Like Nikki said, I'm very passionate about this. We need to really change our mindset on how and what we feed our children. Good nutrition not only contributes to young children's physical development, but affects their cognitive development as well. Children who consume unhealthy foods can have trouble concentrating, become easily fatigued, listless, or irritable, and are likely to face difficulty in learning, which can lead to behavioral and social problems. And establishing a healthy eating habits early in a child's life can lead to good behavior as they move on to adulthood. So we really need to be cognizant about what we are feeding our children, and we can do things like educate our families on good nutrition and health.
Oh, that's great. And like I said, Nicole and I are both very passionate about this. I have spent a lot of time doing a lot of continuing education on nutrition and learning really how it affects. It blows my mind daily, some of the things that I learn, even from something as simple as our soil, our natural soil has been so depleted that we're not getting vitamins and minerals into our vegetables like we had, 30, 40, 50 years ago. One of the books that Nicole and I are working on, we're utilizing this book as the main resource, but we're going to do nutrition information for parents. It's called Fast Food Genocide. I don't know if it's backwards for you guys, but it's called Fast Food Genocide by Joel Fuhrman. It is an amazing book. I swear every time I read a sentence, I'm like, that is so profound. But it talks about what nutrition is doing, poor nutrition is doing to our children, to our even our adults, that fast food is addictive, that there's so many toxic chemicals in our foods, and then how that's affecting. So what it's causing in mental health issues, what it's causing in chronic disease. I'm again a firm believer that the nutrition is kind of where it needs to start. And we all know that nutrition is very difficult for ourselves, for our families, whatever is easiest, and I get that as a parent. This was Joel Fuhrman, Fuhrman, apologies.
I have to say, it's the greatest book I've ever read, and it can be life-changing for people. It's an amazing book. So I would highly recommend it. I got it at the library, so it is at the libraries, the local libraries.
Okay, so now that I've really pushed nutrition for you guys, we'll move on to behavior concerns in the classroom. So this is pretty much the exact same thing that I was talking about in the last slide, except we're doing a little bit of a twist and saying, okay, so we know, in the last slide, we're talking about kids coming into the classroom, and we know about their chronic condition. We know that they have these issues and how it might affect the classroom. What we're really trying to focus on in our school readiness and success for African American boys and across the program in general is kids who present with behavior concerns first. Okay, so if they have potential behaviors, if we're going to talk about a referral process, we're going to talk about issues, what do we do? And it's weeding out those health concerns. So when a behavior concern arises, what do we look at? Well, we look at their medical statement. And Tam, if you could click that link. So we all know what the ODJFS medical statement looks like. And I have to say, I struggle with it when students turn this in, because this whole top section is just like data information, child's name, physician, etc. Then there's this giant section about immunizations, great, very important. But then you have this optional recommended assessments and screenings all the way at the bottom with this tiny section for notes. If I'm a provider and I'm filling this out very quickly, like what's the minimum, how can I get this? I'm overstaffed or understaffed and overbooked. These come back blank so often, and there's no real good information that allows us to be partners with the provider to support a kid if they have chronic conditions or even a high lead level. Like, how do you know? Like, did they put it on there? Did they not? And then if a child has turned this in, who is reviewing these? And is this something that we're pointing out to ourselves? Like, oh, wow, this kid has these issues that maybe the parent didn't disclose. So I bring this up just to kind of point out that section at the bottom. And then we'll talk a little bit more about what we have done to address this in our program. When a behavior concern arises, we also look at our vision and hearing screening results. So again, if it is on that medical statement, somewhere to look. If a child is struggling to see, they're going to be struggling to learn. And if they're struggling, if they're being expected to do something that visually they're not able to do because they can't see or they can't hear, you're going to end up with behaviors. It just makes sense. And so often kids don't even know that they have an issue. They're like, this is how everybody is. I never knew that I wasn't able to see, and they're good at hiding it too. So I've had many kids fail vision screenings where parents are like, they can see fine. And then it turns out that they cannot see very well at all. And nobody had an idea because the child just adapted. Lead levels, we talked about a little bit in length. Checking to see when those were done, if those were done, and what the results were. Hemoglobin levels, again, that's your iron, if they have anemia, and is that anemia affecting how they feel. And then we also do nutrition assessment with the families to see what are they eating, what supports do the families have, what can we do to help the families provide better nutrition. Is that affecting how the child is feeling and their behaviors in the classroom? So the next strategy is engaging the families with family services. So I'll hand this over to Nicole Shetterly
All right.
to talk a little bit about that.
So you really never know what's going on with a family unless you ask. And if families are struggling at home, this can affect the child's health, mental health, and behaviors. So families could have a loss of job due to health issues, chronic stress, increased medical or mental health issues. I just had a conversation with somebody who works for the mental health agency in our area, and the mental health calls over COVID have increased by so much. Like, just it was unbelievable. So we do have some issues going on with our families. What we can do is, we can communicate with our families, obviously, just asking the question, how are you doing? What's going on? Is there any way I can help? We could do a needs assessment with families. What are their basic needs, or what kind of needs do they have? And if they identify something on that needs assessment, we can connect them to a community resource. And from that needs assessment and connecting to a community resource, we could set goals with the families and work with that family as a partner to really reach those goals or attempt to reach those goals. And the biggest piece of this whole thing is follow through. If you are communicating with a family and you say, how are things going? And they disclose things are not great, follow up with them, contact them again, reach out to them, ask again, how are they doing? Are things better? Can I help? If you do a family goal, follow up with that. So really, really connecting with that family and making sure that they're connecting to resources in the community if they have a loss of job or they have a medical condition that, a lot of our families don't have connections to medical health providers. So making sure they're connected.
Thanks, Nicole. And then our last section, before we kind of move on to, what we can do in the classroom, I just wanted to touch on health screenings. So at TPS, we do the screenings ourselves if we don't have results from that medical statement. And we've done a lot of data in our school readiness and success for African American boys collection to say, how do African American boys compared to other, Black girls or other children in the program? And we have found, as far as screening results, there aren't many disparities. So, Black boys aren't, more blind than other kids more often, don't have more hearing problems in general. Like, there's not enough of a statistical difference. So we're saying, we know that there are concerns. What's our next step? And our next step is basically collecting data regarding follow-up. So maybe they have vision screening failures at a similar rate to other children, but the follow-up to getting glasses may be lower. And why is that? The disparities from the providers. Maybe they're not getting the support that they need, or the belief in the from the providers, or you've got that minority stress and other chronic conditions going on with the family that maybe is preventing them from follow-up. So we're going to be working on that data collection and addressing the barriers to follow-up in our African American boy families. All right, so looking at our last objective, because this is all well and good, but what can we do to really support? We've got 4 different areas. So we want to acknowledge, we want family engagement, social emotional curriculum, and then health resources. So acknowledgement. We want to acknowledge that there are health disparities. I've given some information at the beginning, and again, it's hard to really feel that in your soul until you start digging yourself and saying, yes, this exists and it's horrifying, but really acknowledging that, and also understanding that, and I don't know if Janine touched on this, but we want to support all children, not just African American boys, but we want to keep the disparities in mind. So we're providing all of the supports, but we also we want to say and acknowledge that I've provided this support to this child or this family. They may struggle to get to my expectation more than another child or family because of these disparities. But again, the decision, and this comes from OSI language, which is the Ohio Head Start Association, the decision to start with a focus on Black children is based on the premise that effectively addressing equity for Black people will result in the enhanced experience of equity for other marginalized populations. That's where we're starting, and we think it's a really good place to start. But finally, creating this culture of understanding. I feel like probably every presentation you're going to get today is going to be like, this is something big, keep this in mind, apply this to your program. But that's how change occurs, is really creating this culture that this is an issue. We're going to have empathy. We're going to have compassion. We're going to understand and support. We're going to do what we can for these children and these families based on their disparities. Nicole, you're muted.
Sorry. What can we do? Obviously, communication and building relationships is key. We want to build staff-family relationships. That is so, so important. And you guys all know that. And we've heard that a million times. But it really, truly is. We just want to make sure that we're communicating with families. And what we don't know, we don't know. So just making sure that you are talking to families, asking them how they are, communicating is the key. Doing home visits. We can definitely do home visits if we're having trouble connecting with a family. There's something going on and we're not sure what's going on. It doesn't hurt to do a home visit and see what's going on in the home. And we also have, there's all over the internet safety protocols for home visits. So I'm sure your agency can provide that as well. But home visits are very important to understand what's going on in the family's home. The Step Up to Quality questionnaire, family questionnaire, which we also have funds of knowledge, which is very similar. It's a way to gather information about the family and learn about their routines, their cultures. This really should be intentional. If you're gonna do this, make sure you read through these and understand what the culture is, what their routines are. And, it's just like when Nikki was talking about the medical, really following up with it. Don't just check a box that you completed this form. I know it's a requirement for our childcare centers, so we do sometimes check boxes, but we really want it to be intentional. So really understand where the family is coming from. Maybe the parent works third shift, that can be very challenging. So the more we know about a family, the better we can serve the child. So with a needs assessment, if you do a needs assessment with families, you can build programs, activities based off those needs. So let's say a lot of your families identify they're having issues with financial security. You can bring in a financial coach and talk about finances, basic budgeting, credit repair, all of those things. So really look at what your families need and bring in activities to match those. And then also you can compile area resources. There's a ton of resources in Lucas County. There really are. And I know they constantly change. There's things that come and go, but there's a way to keep up with that. I know 211 has their website, but the best way that I keep up with it is from families. Families will say, hey, there's this new food pantry or there's this new program out there. Really communicate with your families about that, but really bring it together a resource binder, everything's electronic now, so you can do a Google Drive with all kinds of resources so that your staff can access that to share with families.
Thank you, Nicole. So one of the things that we talked about is connecting to the classroom. And that's been a common theme throughout our conversation. And one of the things that I know we do, and I know that, Great Lakes does, and Early Head Start, Lucas County Family Council uses as well, is conscious discipline. For those of you that are on here that may not use it or may not be aware of it, it is a fantastic program to support the social emotional learning of our students in our classrooms. But it's not only about supporting the students, it's about supporting the staff as well. So for those of you that are fully aware, I'm preaching to the choir here. But one thing we've realized is that it is a common conversation amongst us on how it really makes the adult self-reflect first. And it engages you on how to assess how you're feeling in this moment and to move yourself into a position where you're ready to engage with that student and help that student and that child feel their feelings and that it's okay. So it has these, specific methodology where it looks at the brain states. It looks at the 7 powers of the conscious adult. It also has another component called adult social emotional learning as well within the system. It does look at creating a school family. So all of the systems, all of the pieces we are talking about is creating that school family. When you're talking about communication, you're talking about health, you're talking about family services. That is such a huge component of a child being ready for school, feeling safe in their environments. And then the 7 skills of discipline. Main focus on self-regulation, sense of safety. A sense of safety is, especially within the last almost 2 years of COVID, is something that our main focus should be on with the students, building those relationships with adults. So we focus on building a relationship with a teacher and feeling safe with their teacher inside their classroom. But that teaches them how to feel safe with a doctor, how to feel safe with a dentist. When they start to learn how to build these relationships and feel safe and be able to self-regulate, they're able to process those high anxiety moments within their life. So it is something that I would highly recommend One of the things I did want to highlight, and I did link in the Conscious Discipline website, there are a lot of free resources. The main book is around $30, I think now. But even if you just start with one thing, we have shared a lot of resources that we are capable of providing because of our the district we're in and because we are a part of the Head Start program. But I understand and came from a child care center that was not connected to all of these resources. So a lot of people out there that may be in these child care centers are questioning, okay, this is amazing. You guys can do all of this. How does a standalone child care center do this for their families without the capacity? And so here's what I challenge some of you to do is if you look through these slides and you see one thing that you can start doing, one thing you can implement, start there and it will make a huge impact. And look at the capacity within your center. When we're talking about communicating with the families and doing the funds of knowledge, most of your teachers are already doing the Step Up to Quality questionnaire, which is similar. Being intentional with that, that's a start. If you are able to compile a list of local resources and just hand that to your teacher, and if a parent discloses and builds that relationship with the teacher, then the teacher has that right at their fingertips. That's a start. Maybe your secretary, if you have secretaries at your staff and they're the ones that are getting an extra eye on that medical statement now, that's a start. And then I'm thinking with the conscious discipline, if you can, even purchase one piece of it, just to start. Look at the free resources that are available online. Reach out. We are a resource here at Toledo Public Schools. We can definitely help connect you with those resources. I can talk with you about conscious discipline. We have, capacity to do, work with you and do some training. It's a start. And that's all I think that, and I hope I'm speaking for all of us, but I think that's our intent, is to help everyone just understand that this is a big conversation and there is a lot in here, but we truly believe that even one tiny step will make a huge impact. So for our classrooms, where we started with our students and our staff is by introducing and implementing conscious discipline. So thank you very much.
And so our last, we're going to finish up with health resources. And I'll say, I think, as Tam was talking about conscious discipline, the big word that pops out to me when we work with our kids and that is resiliency. We are trying to support them to be resilient, which is, if you look at the sad trajectory of a lot of Americans in general of where our health is going, you kind of need to be resilient to handle all of the situations that have been going on in the world, and then especially in health. And one more thing I wanted to tie in, with our families and with resiliency and the effects. It's really interesting too, that chronic cortisol, that chronic high anxiety issues start out right when the mother is pregnant. So that high cortisol exposure in the womb, it's going to affect the child for the rest of their life. It really will. And I know, even I have 2 children and they're very, very different. My first, I had just started my job. When I was pregnant, it was a very hard time. We were building a program from the ground up. I was, almost in tears every single night. And he has a lot of anxiety issues now. I mean, it just was amazing to me how I'm sure that affected him. And if you think of our families and some of the situations that they're in, and when they're pregnant and maybe they didn't even want to be pregnant and they're struggling, conscious discipline is amazing to help in the classroom and then to help our children. So if we're looking at other health resources, to support our families. Tam mentioned tying in the teachers and secretaries to look at health concerns and really be like, okay, we have a problem here. We have a behavior. Pulling in that extra focus of, is it a health issue? Consider your ODJFS medical statement. So we pulled that up, we looked at it, we said, it's a little lacking in my nursing opinion, honestly. It is not a prescribed form. You can, as long as you're hitting all of the points, have your own. So at TPS, we have our own, and it says, did you find any abnormalities in this exam? If you found abnormalities, what is the plan? Like, was there a heart murmur that the child needs to go to a cardiologist? Was there behavioral issues that they have recommended OT or anything? Are they recommended the child be evaluated? What is going on that the provider is noticing, and that doesn't get transcribed onto that ODJFS medical statement? So it's considerate. Nutritional resources, again, my love is nutrition. There's a Ohio Healthy Programs that you can become Ohio Healthy Program certified and go through that. Prevent blindness training. Anybody can be trained, or you can bring in people who are prevent blindness trained to do vision screenings. It's something to think about in a center. At Toledo Public Schools, we have school-based health centers now, which are run through Health Partners of Northwestern Ohio. They're an FQHC, so they'll take anybody insured, not insured, help you get insured. They are currently at our Waite, Rogers, Scott, and I think one just opened. I don't know if it's all fully up functioning, but I feel like it is at Woodward. And they are a great resource that if a family needs something right now, because sometimes providers book, if they need something right now, we recommend those school-based health centers for referrals. And then just if you find out that a family is going through something, they're struggling, they've got health conditions, a parent is sick, a child is sick, they're trying to navigate that medical system. I've been in the medical system on both sides as a patient with an intense condition and as a nurse. And I will tell you that it is not set up family friendly for anybody. Not even as a nurse with the medical experience and background can you navigate it very easily. So encouraging families, if they are struggling in that medical system, to seek out. There's clinical ombudsmen at many clinics that will advocate for families, and then they also sometimes have things, just patient advocates. They're very similar. Really encouraging families to seek that out and get that support so that they are understanding their condition, understanding their treatments, understanding what needs to happen, the plan, and the course. Those are some resources that you can consider when supporting the family. So it looks like we're at, we are at about 11 o'clock. I know we wanted to have time for questions. We also had a video. If we didn't have questions, we have a video that we could share. I found it very, very powerful about health disparities. So I guess I'll turn it back over.
Nicole, did you link in the video? Nikki?
It's in the notes for the last
Okay.
slide.
Let me.
Does anybody have any questions at this time? You can put it in the chat or just unmute.
So I have a question. I think it's for all four of you, anyone who wants to address it. A number of us who are in this session work with pregnant moms or infants and toddlers and their families. I'm wondering what you all think of from the preschool side, specifically what we can be doing to support children and families before they get to your door. I know a lot of the resources you mentioned are things that any of us can use, but do you have specific recommendations for us?
I think from the health side of it, if I come from that lens, really supporting families to follow up with their recommended well child checks. I mean, there's a million, and trust me, it's hard to do, even as, it's just hard. So getting families in that expectation that, empowering them, this is what's expected, or at least recommended. following up, going to the dentist by age 1, going to your regular well child checks and realizing that this is an important thing so that providers have that timeline and that overall, I think from the health standpoint, and then nutrition, always nutrition. That was what I would say. Does anybody else have from other standpoints?
I think that sometimes where we might run into some complications is, I think we forget sometimes there's a fear attached with maybe going to the doctor, right? And there's so saying, obviously reminding families the importance of attending these visits and regularly attending these visits is essential to the health and wellness of the unborn child or the infant and toddler. But I think oftentimes it's really building the relationship from the start, if you can, with the parent or with that mother, that pregnant mother at that time, to really find out what is the barrier for her first. And it's so much easier said than done. And again, I understand capacity in an individual childcare center. And oftentimes that is left maybe to the teacher, because at that time, the teacher may be the only one that really has the relationship with the parent. So I can understand the struggle, but I often think that there may be something other than just a lack of wanting to go to the visit. I feel like oftentimes there is some other barrier. And it could be something like transportation, and then we can connect with resource to get transportation. Maybe it's helping them to actually schedule the appointments, and that, and that can get challenging too with the capacity piece. But sometimes there are other barriers, and it's that communication, I think, trying to figure that out. Teresa, your hand's up. You're muted.
Sorry. I really appreciate what you're saying. And I do think the relationship is just so very important that we kind of figure out and do figure out what is that barrier. And the other thing I wanted to talk about was the minority stress. I love how you guys put that in there, and for us to kind of be thinking about that just recognizing the prejudice that is out there and the stress that takes. Sometimes people aren't going to the doctor because of how they've been treated. And just the reality that there is racism that does exist. There is institutional racism. There are structures in place that are just so very difficult. And Chrissy, I appreciate that you brought up that, hey, what can we do to try to help that early on, beforehand? Because I think all of us in all stages can start to try to address some things and try to bring about a little bit of change, just simply by awareness, at least, is a start.
I agree with you 100%, Teresa. I struggle a lot with, because I feel like there's a lot we can do, as programs, is like, I'm going to say like lower level of what we can do to support minorities and really have that culture of appreciation, acknowledgement, and understanding. But you also have to, like, if it frustrates me because it needs to be like systemic, it needs to be way up. It really does. Like, I feel that struggle, because it's like, oh, okay, little me is about to change the world, but if it's not up there yet, we're going to hope that it gets there someday, and really do what we can to acknowledge and support from our level. I feel that strongly.
I just wanted to throw out there that I think building the relationship with the families is very important, but also try to showcase diversity in different type of positions. A young Black mother may feel comfortable initially talking to another Black mother, or a woman may feel comfortable going to a woman doctor, a man, things of that nature. So I think if we try to diversify what we present, that might help break down some of the mistrust And it doesn't stay like that, but sometimes people are just more comfortable. They say, they may have experienced some of the things that I've experienced, so they'll understand me. So I know we don't have, like, we've been looking for a list of African-American doctors in Lucas County, and we've struggled to find a list that way, but trying to help people feel more comfortable, getting volunteers who are in positions who can talk about health-related issues or social and emotionally related issues for our minority groups and all groups could be helpful, because representation matters.
Janine, that was absolutely fantastic. Thank you for sharing. I am going, unless there are any other questions, I was going to try to share this video. So I'm going to stop sharing my screen and then try to reshare the video like was done earlier today. So give me 1 second.
Just don't forget to click that button on the sound and video.
Okay. Okay, now let me try this again.
And just to let you know, I believe the video is about 5 minutes long. No sound.
We don't have, right.
So it did not give me this.
I think on your computer, you have the sound turned off as well. At the bottom of the video.
Oh, thank you. Okay, let's see.
Anything but the wrong.
Can you hear that? All right. Let me start over.
The world has got to
Can you
change.
make it full screen?
I lived in a community that was so prosperous, with doctors and lawyers and politicians. Now we have drug dealers and corner stores that they don't sell anything but the wrong things. You cannot deny the impact that it has on people's health. I have been in West Baltimore my entire life. As far as money, my mother didn't have any money. I don't want to say she was poor. I'll say low income. Poor we were, though. In the 50s, we didn't have many choices as far as healthcare. The healthcare system then was limited. It was not good for us. And medicine costing so much that my family says sometimes, will I eat or will I pay for my medicine? Oh, I just love my daughters when they come over and we get together and we cook and prepare meals together. It's healthy meals. When my oldest went to college, she came back with a different diet. Now what happens is if I do a meatloaf, it's turkey instead of ground beef. You know, I make spaghetti, I make chili, stuff like that. It's with turkey and chicken. We grew up, we ate pork. We ate bacon, we ate a fresh shoulder, we ate pork chops. I did not think it was not healthy eating, right? Because this is what we were accustomed to. I was in denial. I didn't want to face the fact that I was becoming a diabetic. The impact is the fact that my family ended up with heart disease, emphysema, diabetes, cancer. My mother's sister, her daughter died of diabetes. She was an amputee. My mother died of a massive heart attack. And
to address health disparities, we need to understand why they exist, that they're not due to one single factor. They're the result of policy decisions we make as a society. They're due to the environment, health education, insurance and access to care, access to healthy food, and stress. Those stresses are actually experienced disproportionately by people who are poor and people who have been historically disadvantaged in this society.
solutions to these problems cannot just be medical, it's systemic. And that means everybody has to get involved.
If we want a nation to be strong, the people in that nation have to be healthy. They have to be well. If there's anything that we can do to stamp out disparities, we need to do it by any means necessary.
Hi, Ms. Simmons.
Here at East Baltimore Medical Center, most of the patients are underserved. We need nice deep breaths coming up through your mouth. Michelle is a terrific success story. There was actually a year where she had lost her job, and before she found a new one, she had no health insurance. And she still managed to buy her medicines out of pocket, paid out of pocket to come and have doctor visits. She was really invested in her own health. That's something that Dr. Cooper's research is looking at, why patients don't invest in their health like we wish they would.
Next thing on the agenda is the community update. So I'm going to Michelle joined our community advisory board in 2011. We provide education to the community about health and about research. We offer training programs for community health workers. We can be sure that we are meeting the needs of people appropriately and that we're not leaving out certain groups of people that have traditionally not been included in conversations related to health and healthcare. Our strong relationship with the community is just essential. There's no way that we could do what we're doing without their input. And my work is just one of many initiatives here at Hopkins.
Ms. Simmons is a great example of what happens when we get it right as clinicians and as an institution.
I am a fighter. I am a believer. I stand for what's right. And what's right is people's health. And I will never give up as long as I have breath in my body.
One of the things that is so important is that people have what I call a liberated future. And it's hard to be liberated when you're not healthy. When I say liberated, I mean freedom to be all that God meant for you to be. When we don't deal with disparities, then what we're doing is denying people an opportunity to give back to the world. So we've got to fight it. We've got to fight it with everything we've got.
So I just want to say thank you. I'm sorry, I feel that's a very powerful video. And I just want to say thank you for joining us, for sharing in this conversation today. And Nikki, Nicole, Janine, any final?
No, just thank you and reach out to us if you need us, please.
Yep, thank you so much. And I believe we are complete for today. Thank you.
Thank you.
Thank you, ladies.
Thank you all.
Thank
So
you.
everybody, we have another quick little 15-minute break. You will need to go back to the main room. So go back to that interactive agenda and click on the link for the next one, because we are going to have ABCs of movement to take us into lunch, get us moving a little bit before we sit for our afternoon then. So take your break and then head on over to the main room.
Thank you.